You may think social media is just for entertainment, but in healthcare, it's transforming patient education, trust, and engagement. If you're not using it strategically, you could be missing out. In this video, I'll explain how to use social media to effectively market your healthcare brand. You may have heard that social media marketing in healthcare is too risky due to regulations like HIPAA. While compliance is crucial, avoiding social media altogether is an even bigger mistake. You may also know that misinformation spreads faster than the truth, especially in healthcare. I'll show you how to navigate these challenges while making the most of social media's potential. I'll break down how to build trust, combat misinformation, and engage with patients and other healthcare stakeholders the right way. I'm Lena Chang, Managing Director of Best Friend Jack. Stick around till the end. I'll be breaking down real healthcare social media campaigns that worked and explaining why they were so successful. Social media has become a critical tool in digital health marketing, but many health tech companies struggle to use it effectively. Whether you're a startup founder, a marketing leader, or an executive at a healthcare organization, understanding how to leverage social media strategically can help you drive engagement, build trust, and scale your business. Let's break down 3 key ways social media plays a role in digital healthcare marketing. First, there's organic social content. Social platforms offer health tech brands a cost-effective way to reach their audience without the spend required for paid ads. While creating high-quality content does take resources, organic social lets you distribute that content widely at little to no additional cost. Some examples are patient testimonials, explainer videos, blog posts, or interactive Q&As. What is social media's role in digital healthcare marketing? Paid social fills the gaps that organic social can't reach. It's how you scale fast, test your messaging, and reach people who aren't already following you. You can also tailor your message by audience and intent. Facebook can be great for older adults and even healthcare providers. LinkedIn helps you reach healthcare executives, and Instagram and TikTok are where younger people are looking for creator-led content. Then there's driving technology adoption. One of the biggest challenges in digital health is getting patients to adopt new technologies like telemedicine and remote patient monitoring. Social media can be a powerful channel to show potential users the convenience and benefits of these technologies and address common concerns. Now let's talk about the benefits of social media in healthcare. The first one is enhancing patient education. Let's face it, these days everyone is searching for health information online. But the key question is, who can people trust? If you can position yourself as a trusted resource who shares thoughtful, science-backed content, your company can help combat misinformation while guiding patients toward better health decisions. You can also use social media to build trust with healthcare providers and executives. For B2B health tech companies, you can build credibility among your target audiences by offering transparency in how your platform or service works, sharing real-world case studies, and showcasing clinical validation. The next benefit of social media is for health systems and provider groups, and using it to strengthen your brand reputation. This can be a tricky one because it requires consistency and posting high-quality content on a regular basis. You also need to respond to patient inquiries and comments in a timely manner. But if you can commit resources to that, as well as highlighting patient success stories and sharing behind-the-scenes content from clinicians, these will all help you build trust. The last benefit of social media that I want to mention is that it's increasingly being used as a communication tool between healthcare providers and patients. Assuming you're doing this in a HIPAA-compliant way, you can use social platforms to answer general health questions, share important updates, and guide patients toward the right resources. Why patient engagement on social media is essential for healthcare and health tech brands. So this is for companies that have a direct-to-consumer or B2B2C model. First, a well-managed social media presence can help you build a supportive community. Think about patients who are dealing with chronic conditions, mental health challenges, or new diagnoses. They're often looking for community support. If your social media can offer that community, it can foster a sense of belonging, encourage peer-to-peer support, and position your brand as a valuable part of their health journey. Social media can be an amazing tool for preventive care campaigns, for everything from routine screenings to lifestyle changes. Digital health companies can use these platforms to drive behavior change and help reduce the burden on the healthcare system. Next, social media can help make your brand stickier over time. It lets you offer more than just a product. It's a way to show patients you're invested in their whole experience, not just one transactional moment. By sharing your unique science-backed perspective, not just generic health tips, patients get additional value out of their relationship with your company, and that breeds loyalty. The fourth reason is that social platforms allow companies to respond real time, whether it's answering patient patients' questions, providing insights about escalating public health concerns, addressing service issues, or clarifying trending misinformation. Lastly, social media helps drive digital health adoption. It's a really powerful tool for educating patients about new technologies. Because it's a visual medium, you can show real-world use cases like a short video walkthrough or a patient sharing how a service made a difference in their life. Seeing it in action helps build trust and lowers the barrier to adoption. When people can see how it works and who it helps, they're more likely to trust it and try it. Now let's discuss best practices for social media in healthcare. The first one is about ensuring HIPAA compliance. As you may already know, we need to be mindful of privacy regulations. Never share patient information without consent, and train your staff on proper social media use to avoid compliance risks. The next best practice is audience-centric content. Truly engaging content starts with understanding what your audience is going through, then creating content that answers their questions, calms their concerns, and helps them take the next step. Use the language that they use. Address the real moments they face. Next, don't just track metrics. Use them to shape your content strategy. Look at what topics, formats, and platforms are driving the most engagement and why. Is your audience responding to more patient stories, explainer videos, or quick tips? Use that insight to double down on what's working, test new variations, and refine your message over time. The last best practice I want to mention is treating social channels like a frontline support tool. Have a clear, consistent process for triaging patient questions, responding to concerns, and escalating sensitive issues offline. Don't ignore negative feedback. Acknowledge it respectfully and look for patterns you can fix upstream. How you respond publicly can build more trust than the original post ever could. What are the challenges of social media in healthcare marketing? Social media can be a powerful tool, but in healthcare, it does come with real challenges. Here are some of the biggest ones to watch out for. First, there's privacy concerns and regulatory hurdles. HIPAA, GDPR, and other privacy laws means you have to be extra careful about what you share. Make sure your team knows what's off limits and build guardrails into your content review process from the start. Another challenge is misinformation. As you might know, health misinformation spreads fast online. Use your platform to set the record straight. Share credible, science-backed information in a way that's easy for your audience to understand and trust. Then there's managing negative feedback in online reviews. Every company gets negative feedback at some point. The key is to respond quickly, respectfully, and consistently. And if you see the same issue pop up more than once, it might be a sign to fix something deeper. Finally, there are ethical concerns. For providers posting on behalf of your brand, make sure they're clear on boundaries, protecting patient confidentiality, avoiding medical advice in the comments, and staying aligned with professional guidelines. Finally, I want to share some real campaigns and why they were so successful. We'll go through 2 direct-to-consumer examples and 2 B2B examples. Let's start with the Mayo Clinic. You might not expect a major health system to show up on TikTok, but they do, and they're doing it really well. They post short, clear videos with doctors explaining common health issues, like signs of a stroke or when to worry about chest pain. What makes it work is the credibility of the source paired with content that's quick, visual, and easy to digest. So it's both educational and accessible, and it shows that even traditional institutions can meet people where they are online. Tia is a great example of using Instagram to reframe the way we talk about women's health. Their content is clean and modern, from period pain myths to fertility tips. What sets them apart is tone and design. It feels like it belongs in your feed, not like a doctor's office trying to go viral. It works because it's empowering, informative, and rooted in real clinical guidance without the jargon. On the B2B side, Included Health is doing a great job using LinkedIn to tell stories that connect both emotionally and strategically. They highlight real patients, share how their care model improves outcomes for underserved groups, and spotlight employer and health plan partnerships. It's not just product marketing, it's mission-driven storytelling with metrics behind it. That combination makes them feel like a partner, not just a vendor. One Medical uses LinkedIn to position itself as a modern primary care solution for employers. Their content is people-first and design-forward, just like their product experience. They don't just talk about access, they show what it looks like through staff features, patient store, and client success posts. It's a great example of B2B content that's clear, credible, and still human. Social media can be more than just a marketing channel. It's a powerful tool for education, engagement, and patient empowerment. Whether you're a digital health startup or a large healthcare organization, having a strategic, compliant, and patient-focused approach to social media can set you apart in an increasingly competitive landscape. If you found this useful, be sure to check out our other content on digital health marketing strategies.